Okay.
Hello, everyone. Welcome to today's GE-NMF Primary Care Leadership Program Orientation for 2016 Scholars. My name is Jessica Allen, and I'm the Senior Program Associate for PCLP. I'd like to note some housekeeping rules before we begin. You have each been muted upon entry. This is to help minimize background noise on today's webinar. If you have any questions throughout the webinar, you can type them into the Q&A box or the chat box at the bottom right of your screen. And if anything comes up in the middle of it, feel free to type at any time. I've also typed my email into the chat box for your reference. As a reminder, if you are listening by telephone, there are some recorded pieces in the first two sections that you will not be able to hear. We encourage all users to listen to today's webinar through computer speakers. Here's our agenda for today's webinar. First, there'll be an overview of National Medical Fellowships by its President and CEO, Dr. Esther Dyer. Next, Dr. Joy Jones, the Director of PCLP, will provide an overview of the program. And finally, I'll go over the program requirements for the program. So now I'd like to introduce Dr. Esther Dyer, President and CEO of National Medical Fellowships, who will provide an overview of the organization. As Dr. Dyer noted, you are joining an accomplished group of NMF alumni by being a PCLP scholar. Next, we'll hear more about our program from Dr. Joy Jones, the Director of PCLP. She'll provide a brief overview of the program's history and of its purpose. I hope that overview provided a better context for PCLP. Briefly, we'll have a few comments from Scholar alumni about their experiences. Now, we'll talk more in depth about the program requirements and expectation of PCLP scholars. Again, if you have any questions about any of the requirements, you can chat them either in the chat box or the Q&A box, and we'll get to them in the discussion section at the end of the webinar. Here's a list of topics we'll be reviewing today. Much of this material you have already read in your Scholar Handbook. Each scholar has been assigned a PCLP staff member as their main point of contact. If you are placed in Atlanta, Boston, Chicago, Houston, or Los Angeles, I will be your main point of contact. If you are placed in Miami, Mound Bayou, Phoenix, Rochester, or Seattle, Sam Hahn will be your main point of contact. Our contact information can be found on the screen, and I believe most of you should have already received an email from one of us introducing ourselves. Prior to your arrival to your placement site, please review the Scholar Code of Conduct in your handbook. Each of you are expected to behave in a professional manner that reflects positively not only of yourself, but also of your home institution, your placement site, and of PCLP. Here's a brief overview of what the Code of Conduct contains. In the upcoming weeks, each scholar will receive an invitation to join Canvas. Canvas works similarly to Blackboard, which I assume most of you have worked with in either your undergraduate or graduate careers. You will upload all of your program requirements to Canvas, excluding any surveys or evaluations. You will also be able to find your assignments, guidelines, and any templates associated with each program requirement. Reporting of your time on site will come in two forms. Each week, you'll be asked to submit a status report where you'll be able to document your activities on site and any progress you've made on your project. This is also a great space to reflect on your experience, as your 6 weeks on site will go by quickly. At the end of your 6 weeks, you'll be asked to submit a timesheet documenting your hours. We strongly suggest that each scholar prints the timesheet either during their first days on site or prior to their arrival, so that you can have it ready to go to start documenting your time on your first day. This will be a lot more helpful than waiting till the end of the program and trying to remember how much time you spent on what in those early weeks. On the screen, you'll see a list of items that are included in your 200 service learning hours. Each scholar will be paired with 2 mentors. Your site supervisor is a champion of PCLP who works at your placement site. They will assist in completion of your on-site program requirements. You're expected to meet with this person once a week in person. Your faculty advisor is a distinguished faculty member from a local university who will primarily assist on the academic components of your PCLP project. You'll also have weekly interactions with this person, but since they won't be on site, it is okay if those interactions are by phone or email. Each faculty advisor and scholar are required to have at least one in-person meeting. We'll be sending contact information for your mentors by the end of this week. The purpose of the leadership training curriculum is to introduce scholars to the key roles, priorities, challenges, and competencies of primary care leaders. This year's curriculum has 3 units. Each unit will have reading and video assignments that will prepare you for the seminar discussion that is a part of that unit. On the screen, you can see some of our guest speakers for our seminar series this year, and the final unit will prepare you for our PCLP symposium, which I'll touch on more in a bit later. Each scholar will also be required to interview 3 members of leadership at their placement site and use the material from those interviews to craft a reflective essay on primary care leadership. Your site supervisors will assist on scheduling those interviews. Each year, our funder, the GE Foundation, hosts a webinar for scholars on lean principles and project management. This year's webinars will take place on May 18th and 19th. Both of these sessions will review the same material, so you are only required to attend one of the sessions. The session times can be found on your screen. For those of you who have discussed PCLP with our Scholar alumni, this next component was previously referred to as the Independent Service Learning Project, or ISL project. Currently, our site supervisors and faculty advisors are meeting to identify and scope appropriate team-based projects on specific areas for community health center operation. The PCLP project will enrich your research-based skills and provide a better understanding of the factors that affect healthcare delivery and health outcomes in the community health center setting. As I mentioned, this year, each scholar will be paired with one other scholar to create a team, and that team will implement the project together. Each project will consist of a proposal, a written report, a PowerPoint presentation, and an executive summary. Only one of those components needs to be submitted for each project. On the screen, you can see the outline for the report and presentation components. Additional guidelines and templates can be found in your handbook. The project will be a large component of your PCLP experience, so we expect each of you to take it very seriously. Some of our scholars have been able to secure additional grant funding for their site partners or have gone on to present their work at noted conferences. We will be sharing your work with our stakeholders, including our funders. We are really excited about the PCLP Symposium this year, as it's the first time we've been able to bring all of our scholars together in one city during the program period. This year's symposium will take place July 10th through 11th in Chicago, Illinois. And the sessions that will be held there will include discussions of leadership as it relates to primary care and professional skills. Some of our featured speakers for this 2-day summit include Dr. Jack Geiger, who initiated the Community Health Center model in the United States, and Castula de la Rocha, who is the President and CEO of Ultimate Health Services Corporation, one of the largest SQHCs in the country. Additionally, 2016 scholars will be able to compete for the opportunity to present their PCLP project at the symposium. Selected scholars will present an executive summary of their work to a distinguished panel of health leaders who will provide thoughtful feedback. And as a note, PCLP staff will arrange transportation and housing for this event, so you won't have to worry about covering those expenses through your scholarship stipend. There will be program evaluations and component surveys throughout your PCLP experience. This is to ensure that we continue to improve the PCLP experience not only for your time on site, but also for future scholars. The two main evaluations you'll be asked to complete are the pre-program survey about your experience of primary care and a post-program evaluation about your PCLP experience. You may also be asked to submit brief surveys on webinars that you participate as a part of PCLP. Also, we ask each of our alumni to respond to a brief survey that's submitted annually about their activities or career paths since participating in PCLP. Your scholarship stipend award will be dispersed in 2 payments, and each of those disbursements are tied to particular program deliverables. The first installment will be dispersed after orientation webinar participation. So by participating today and submitting the survey tied to today's webinar, you guys have all satisfied that requirement. So as a result, the first payment is scheduled to be released next Friday, April 15th. And the reason why we are dispersing a larger proportion of your award earlier this year is to help with any logistics for those of you who will have to relocate for the summer. The second installment will be dispersed after you submit all of your program requirements and evaluation activities. Payments are scheduled for release on the 1st or 15th of each month, and as a note, it may take up to 1 week for the payment to show in your account. The next items I have are some more logistical pieces for PCLP. When in your written reports and when referring to the program, please be sure to use the full name of the program. I understand that there's a lot of abbreviations and it's kind of long, but also this helps to amplify the program and better tie your work to PCLP. You should refer to yourself as PCLP scholars, and please be sure in any official reports that you submit to use the official name of your site partner. I know that some of our sites will use nicknames or shorter versions when talking to colleagues, but it's best in any reports that you submit that you use the official name of your site. Also, in the past, some of our scholars have created evaluations or surveys as a part of their PCLP project and have branded them to show that it was a part of PCLP. So if you're interested in using the logo on any of your work summer to properly brand your surveys, please let me know and I can help you with that. Now, as I'm sure not many of you know, the PCLP office is located in New Orleans, so we won't be able to get to see you on site this summer. But we're always really appreciative whenever our scholars submit photos about their time on site, because it gives us a direct eye into what their experience was like that summer. So we encourage each of you to use your smartphone, or if you have an old-fashioned camera, take that with you and document your time on site. Please be aware of any restrictions your sites may have about photography and patient confidentiality, and of course, be sure to ask everybody's permission before you start taking pictures. Here are 2 examples of the types of photos that we typically get. The example on the left of our scholar in action is much more valuable than this example on the right, which is 2 photos, or a photo of 2 of our scholars, but it's more difficult to see where or what the scholars are doing. As a note, any photos that are submitted may be used in reports to our stakeholders on NMF's website or in promotional materials for PCLP. Finally, another way for us to have a better experience about, or a better understanding about your time on site in real time is through social media. And again, this is a quick, easy way to keep connected during your program period this summer. So in a couple of weeks, we'll be sending out an invitation to all of our scholars to join the PCLP Facebook group. And this is a closed group that is just current and alumni scholars. And it's a great place to be able to connect with your fellow students in case you want to try to find a roommate for this summer or just hear about other scholars' experiences that they've had. Also, if you have a Twitter or an Instagram account and you want to document your experience through those sites, please use the hashtags PCLP Scholar or NMF Online so that we can find your work and be able to see what you guys are up to. If you don't currently have one of those pages and are interested in creating one and would like some help, just let me know and I'd be happy to help you in creating a social media page. So that brings me to the end of the presentation for today's webinar. If you have any questions about any of the requirements that I just went over or any of the expectations that we have for our scholars this summer, feel free to chat them either in the chat box or in the Q&A box on the lower right-hand side of the screen. Yeah, and I will answer those as they come in. Okay, the first question that we have is there a place to see past scholar projects? And yes, there's an example of a past scholar's work in your handbook, but if you'd like to see additional projects, you can visit nmfonline.org. In the header menu, it'll be a link called Resources. If you click on that, GE-NMF Primary Care Leadership Program will pop up. Click on that, and then they'll give you a listing of all of the cities that we've been in from 2012 through 2014. And if you click on each of those cities, you'll get a listing of the projects that have been done in those cities. But if that was a little convoluted for you, just shoot me an email and I can send you the link to those pages. The next question is, do all scholars at a site work on a project together, or do we create individual projects? So the majority of the sites this year will only have 2 scholars at them for the summer. So you'll be working with whoever your scholar pair is this summer. Some of our larger sites will have more than 2 scholars, but they'll be paired off based on their faculty advisor assignments. So there won't be any individual projects this year. You'll be paired with another student to develop and implement all of the PCLP project components. The next question is, are we able to get the contact information of previous scholars from our placement sites to talk to them about their experiences? And yes, in the upcoming weeks, as a part of your weekly email from either myself or Sam, we'll be connecting or pairing each of you with a peer mentor who is a PCLP Scholar alumni who will be able to share their experiences with you. We try the best to pair our students based on either the site that they, to pair an alum with a current scholar based on site, but since we do have a number of new sites this year and new cities this year, that's not always the case. But we do our best to try to pair either through that or through schools. These are great questions, so keep them coming in. The next question is, I heard you say that we would be getting contact information for our site supervisors and faculty advisors later this week. When do you suggest that we contact them? Okay, so we'll be sending that information out tomorrow, like I said, and I would suggest that early next week, if you want to send them an email, it would be a great way to open that communication. They've also received, both of your mentors will also received your contact information along with your personal statement that you submitted as a part of your PCLP application and your CV. And so they'll have some brief background information on you, but if you want to include any additional pieces, that would be great as well. Maybe things that you're interested in or what your focus has been thus far in your career. As all of our stakeholders are very excited about participating in PCLP, but sometimes they are very busy, as you can imagine. So if you don't get an immediate response, that's okay. Just send a gentle follow-up. But if you're finding that it's, you know, a couple weeks before your program date and you still haven't heard back from your site supervisor or gotten a message from your faculty advisor, just let Sam or I know, and we can do some follow-up on our end to make sure that they have received your correspondence. Next question is the website currently being updated? It seems to be undergoing some changes. And yes, NMF's website is currently being updated. They went to a new model, I feel like about a month ago. So there are some kinks that are still being worked out. If there's anything you're trying to find on the website that you're not able to, shoot me an email and I can either steer you in the right direction or provide you any information that you are trying to find. The next question is, there's a list of dates that requirements are due, but is there a list of dates available for each webinar requirement? I believe those dates are in your handbook, and so those are the GE webinar, which are May 18th or May 19th, whichever one fits your schedule better, and the kickoff webinar, which is May 31st, and then the 2 leadership webinars, which are listed in the leadership curriculum part of the handbook. If you need additional information about those webinars, you can shoot us an email, but Sam and I will also be sending many timely reminders about those pieces moving forward. The next question is, after the PCLP symposium, will we go back to our site for the last week? From dates, what dates should we make sure we have housing for? So yes, after the symposium is finished, you will be going back to your site for that final week. The time block for this year is June 6th through July 15th. So we expect you to be on site Monday through Friday during those times as your site supervisor schedules you, unless your clinic is closed maybe for July 4th, and except for July 11th, which is a Monday. But yes, you should expect to be on site June 6th through July 15th, and each scholar is required to be on site during that time. Next question is, what paperwork do we have to complete for our site? Are there any health clearance or immunization requirements that we should get started on ahead of time? This is a great question. And yes, there's a number of paperwork that each of you will have to complete for your site. We've been in the midst of trying to collect that paperwork from your site, as each site has different requirements of what each scholar needs to provide to be on site this summer. Generally, those pieces include liability insurance, health insurance, proof of immunizations, maybe proof of CPR courses, and then paperwork that is site-specific, such as like patient confidentiality or acknowledgement of a handbook. As part of your weekly scholar email, we'll send out any documents and a listing of any paperwork requirements to you that are required for your site, with information about when those pieces are due and to whom you should send them. The majority of the pieces are typically due, will be due in May. So if you want to start gathering that type of information, that would be a good way to get ahead on that. Can you repeat the 2 dates for the GE Lean webinars again? Sure. So those dates again are May 18th at 6:30 p.m. Eastern Time and May 19th at 3 p.m. Eastern Time. Again, Sam and I will send out reminders about those sessions, and you are only required to attend one of those sessions, as they will be presenting the same material. These are really great questions, guys, so keep them coming in. The next question I have is, are we able to request any time off during the program? So this depends. If you have a commitment that you know of ahead of time, it's best if you share that with your PCLP staff point of contact and your site supervisors early. Typically, if it's just missing one day, that can usually be scheduled around. But if you have a commitment this summer where you'll be missing like up to a week, we'll need to talk about that. And so, yes, if you have another commitment or something else, we can talk about missing a day or so, but a week or something like that is more serious. So it's much more on a day-to-day or a case-by-case process. But if you know right now that you'll be missing time this summer, please let Sam or I know. Similar to that, would we be allowed to take a sick day or two while in the program if needed? Yes, if you're sick, we would hope that you would not show up to the site because that would put others in danger of getting sick. So again, just be communicative to your site supervisor about that and find out what their policy is, or their policy will be for the summer for y'all when it comes to taking sick days. Okay, the next question we have here is, on a day-to-day basis when the program begins, will we be shadowing physicians or nurse practitioners, or will there be other activities that we will be doing to get the primary care experience? So each of our sites are, and to kind of go along with this, the next question is, could you repeat the amount of time we're required to be on site every day? So each of our sites develop the program individually. They're able to mold the program to what best fits for their individual site. So your day-to-day activities and the time that you'll be on site will vary from site to site. Generally, and also when it comes to the clinical part of it, each of our scholars have had varying experiences about the amount of clinical activities that they had as a part of PCLP, and these are usually based on the level of education or experience of that scholar, along with the site and what they will allow a scholar to do during their time on site. So I can't provide more specifics about what your data activities will be, but I know that they will be a combination of the clinical component, the leadership activities, so the interviews with site leadership. Sometimes our sites let the scholars sit in on board meetings and other management level meetings about clinic operations, the leadership webinars, and then work on implementing your PCLP project. And so typically, I believe the students have been on site from about a normal workday, Monday through Friday, but again, your site supervisor is a better person to ask that question to because they'll be the one who is scheduling your time on site. Great. Okay. So again, if you guys have any questions, you can chat them right now in either the chat box or the Q&A box. We have another question here about dress code. What is the dress code for during our time on site? And so we expect each of you to dress professionally when you are on site this summer. Again, this is a great question to ask your site supervisor, as they will have more information about what is typical of the workers who work within that clinic and what is appropriate. But we tell all of our scholars that they should veer on the side of maybe over-professional than under-professional, especially in your first day. Show up on your first day ready to work. Please note open-toed shoes. And you may, for those of you who are medical students, you may want to ask your site supervisors on whether you'll need your white coats during your time on site. Okay, these were all great questions. It seems as if the questions have started to slow down now. So I'll keep this open for a few more minutes. If you guys have any questions, feel free to type them, even if you just want to confirm something. This is a great way to get it answered, and also it'll help others, since there's a great number of you on the call today, to hear the answer. The next question is, if possible, can you please describe the changes from last year, individual projects versus team-based? So the main change is that it's now a team-based project. The program's been pushing for our sites to do more team-based projects to allow the project to be collaborative. And most of our PCLP projects in the recent years who have been more successful have been ones where two scholars have worked together, just because it allows you to take on a greater workload than what you're able to accomplish individually during those 6 weeks. So besides the fact that you'll be paired with another scholar, the only other change is that instead of previous years where when two scholars who worked together on a project had to submit individual papers and presentations and executive summaries for their work or for whatever piece of the project they took ownership of. This year, each team will only have to submit one component, one of each of the project components. So you'll only have to submit one proposal, one report, one presentation, and one executive summary. The next question is, when will we know the exact location address of the site we are going to report to daily? This would make arranging housing plans easier. So as I mentioned, we'll be sending out your site supervisor contact information tomorrow. And once you have that, you are free to contact them to ask them what location you'll be working at this summer. Many of our sites have multiple locations, so it is a good idea to get in contact with them to see which site in particular you'll be placed at this summer to ensure that you'll find housing that can accommodate that. If you are interested in finding out now where some of our sites are located, and for some where the headquarters are, if you go on our website on PCLP's page, there's a page called City Placements, and that will have a page for each of our cities, and each of the city placement pages has a Google Maps with the location of our sites located in that city. So that'll give you a good general idea of where the clinics are located, but your site supervisor will be able to give you a more precise details about where you'll be placed this summer. Okay, does anybody have any other questions about any of the expectations? Do you want me to repeat when any of the webinars are, or, oh, here's another question. When creating our PCLP projects, will this be mainly independent, or will the site leaders be actively involved in assisting us in creating a project? So yes, the sites, including the site supervisors, will take the lead on identifying which projects would be feasible at their site. Again, you'll only be on site for 6 weeks, and so that time will move by quickly, and so we want to make sure that you're participating in a project that will be enriching to you and also feasible to get done in 6 weeks. That will be able to show a meaningful result. So the faculty advisors and site supervisors are currently scheduling meetings to meet to identify possible projects and to scope them to be feasible projects for the 6-week period. Once you get your site supervisor's contact information and your faculty advisor's information, if you want to send them a note about particular things that you're interested in or what your work has focused on in the past that may be helpful in providing some guidance to them on what expertise you may have and what you would be able to bring in regards to the project this year, but the site supervisor will ultimately decide what projects are available to work on this summer at their site. So thank you guys for all these questions. They've been so great. I'm going to be up here for 1 more minute in case anybody has any last-minute questions about the program or any of the requirements. Okay, and if there are no more questions, I think that brings a nice end to today's webinar. So I want to thank each of you again for participating today. As I mentioned during the webinar, you'll each receive an email from me shortly after the presentation's over, asking you to complete a brief survey about the webinar today. And if you have any questions that you thought of later, or if you'd like a PDF version of today's presentation, just shoot me an email, which you can find again at the beginning of the chat box, and I'll send you the presentation or answer your questions at your convenience. So thank you again for participating, everyone, and we look forward to working with you this summer. Have a great day.